a playback for some of our clients. So today we're going to actually be reviewing some blood work. Um, I guess I'll preface, I see some new names here. So this call is designed to answer questions for existing potential clients. We will work through cases with coaches as well. We have some existing clients who have got some blood work done, and I was just reviewing with Charlotte some of their information before we talk about it. Um, I'll do share screen. All information has been redacted, so uh, keeping patient information confidential, and we'll talk in broad terms, so we're not uh, saying anybody's specific names. But yeah, let's go ahead and pull this. And Charlotte, I may have some dialogue back and forth with you here on a couple of these. Um,
Acted to save the innocent, right?
uh, I was thinking of that while I was redacting all this information. So I think that's pretty funny that someone said that. But yeah, I was like, I hope I do a good redacting job so you can't see all the information. But that's a different topic.
We're just showing all. I don't care.
Okay, let's see. I got Ashley coming in as well. Bring her in. Okay, so our first set of labs here is for a existing client currently on some bioidentical hormones. And some of the things that we've been working on is thyroid. So I'm sure she will watch this video at some point. So I will kind of talk directly to her. So the things that we have been working on is finding an adequate thyroid dosing for her. So she's working with the medical team, uh, and just kind of doing some fine tuning here. So initially, patient had come on to this program on a levothyroxine. So a lot of patients may be familiar with that medication. Throughout her probably about a year now, has tried several different formulations of a compounded T4 and T3. So that would be part levothyroxine and lyrothyronine. The interesting thing that I see pretty much across the board, granted, we're looking at two samples here for her TSH, is going to be both of them are suppressed. So, give some context on that. What does that mean? Thyroid stimulating hormone is a response from your brain to the gland. And when it's high, it means the body is requesting to your thyroid to make more hormone. When it's suppressed, it's sensing that there's adequate hormone. There's a lot of further detail with thyroid function. So your free forms of thyroid play a role in here. So we'll look at those. But if we look at her TSH, it's showing that her body has enough thyroid hormone. And that's been something she's been dealing with this whole time. The thing that I will pay attention to, so if you're taking a levothyroxine, up top, your T4 should be influenced by that. So that's that first marker up here. And you can see that she's well within range. That range goes from 0.82 to 1.77. And previously she was at a 0.12, now at a 0.124. Things that you want to think about with T4. So we're looking at a free form. So this is what's bioavailable to tissue. And T4 is not metabolically active. So for those of you who are taking thyroid medicine, specifically levothyroxine, your body has to convert this T4 into this other hormone, your last marker down here, called T3. T3 is going to be a lot more metabolically active. We've been trying to get hers up into a higher normal. Initially, if I look at her first set of labs, which I'm actually going to do on a separate screen, I believe her initial set was, bear with me, 2.1. And then over time had gone to a 2.7 and then a 2.8. Now we're at a 3.0 here. So, things that I would think about, Charlotte, if you're going to relay some information, I'm sure she will watch this as well, is I would see how heart rate is doing with a suppressed TSH. Make sure she's not overstimulated. Sometimes a suppression of thyroid stimulating hormone can give jitters, heart palpitation, anxiety. It's very person dependent. Some individuals feel fine with a suppressed TSH. Some people may have some symptoms. Usually, looking at your heart rate is going to be one of the best ways because specifically T3 will drive up metabolic rate. So, how well your body utilizes calories and energy expenditure. So, it is pretty potent for metabolism. So those would be questions I would think about from the thyroid standpoint. I know when we looked at the labs back in December, because she's doing several sets, her testosterone looks like in a manageable range. And for those of you who may not be as familiar with bioidentical hormone dosing, for this individual in a peri or postmenopausal state, when ovulation may not be as a uh, focal point for an individual, we really want to look at raising testosterone to manage symptoms. And it's a Goldilocks number. So your range based off of her age group is 4 to 50. In December, she was a 78, and then now she's at a 59. So you want to think about where can you get the most benefits from testosterone? Because ladies, you want to think about you're using it as an off-label treatment. There's no guiding or medical guidelines around testosterone replacement for women. It is FDA approved, but there is uh, it's going to be more based on symptoms. So at 78 to a 59, if she feels just as good here at 59 than she did at 79, she probably wants to think about staying at that dose. Your 19-point difference there. Some of the interesting things that you'll see, and I think that uh, some of this can be attributed to liver function. Her free testosterone was actually higher here on her set from 827 to a 1.7 here. And a lot of that is going to be influenced by her sex hormone binding globulin. You want to think of this as a protein that holds on to your hormones. So at a 67, it would make sense her free testosterone is at a 2.8. And then at 102, because there's more of this binding protein, her testosterone may be at a 1.7. So that makes sense to me. Um, yeah. So any specific questions that I didn't answer, Charlotte? I know you have more context with the client here. I wanted to make sure, was it mainly thyroid or was she interested in any of the other sex hormones?
I think there might have been estrogen too, estradiol that went up.
Oh yeah, that is a good call out. So the estradiol, it's interesting. This client is not on estrogen replacement, right?
I don't believe so.
I don't think so. Um, And this is kind of what you'll see in a perimenopause swing. So I will look at the follicle stimulating hormone. It's a response from your brain to your ovaries. When it's high, it's just like a TSH. Your body wants more estrogen when that FSH signals. They're both stimulating hormones. If we look at a higher FSH, she's going to have a lower estradiol. She has a lower FSH, she's going to have a higher estradiol. And I call that like the roller coaster of perimenopause. Every month, maybe a little different. Some months your ovaries want to work and they want to make lots of estrogen. And then other months, they're not doing much. And symptoms can kind of roller coaster too. Hot flashes, night sweats. Those are things that can kind of pulse up and down. So, yeah, that's a good call out. The progesterone is kind of waxing and waning as well. I don't remember if she's on progesterone therapy. Um, looking at that number, uh, I would assume not, especially if it's going from a 3.1 to a 2.8, but I could be wrong there. Um, but yeah, the very limited hormone panel here. Just I think the biggest things is tweaking the thyroid to where she feels her best and she's not overly stimulated. The autonomic nervous system isn't um, uh, overly agitated or rest or irritability or has any restlessness because all these hormones really want to be in balance and we don't want to overdrive any specific hormones. Her TSH is a little weird, but historically, and I'm looking at another set here, um, the only sample I have that where it was within range, and it was a 0.53, so barely above the range because the range starts at 0.45, was back in April of 2025. So just giving some context on that. Um, yeah. Any questions from anybody in general about this small? I'm going to go over a larger set here in a second, but I wanted to pause and see if I have any questions from coaches or Charlotte, if I did an okay enough job for her. And if I didn't and then missing something, definitely let me know.
I kind of have a quick comment. So she was looking into more adaptogenic herbs like ashwagandha, holy basil. Does that directly tie with how low the TSH is, possibly?
I think ashwagandha is something that I've seen where it can have some issues with thyroid absorption specifically. So thyroid medication. I would do some further digging on that. You can probably find some good information. The other one that I see that can have interference with thyroid hormone is, oh my goodness, why can't I think of it? Yeah, I think it is. There's a different name for holy basil. I can't think of it off the top of my head.
Okay.
Um, I believe that can also have some interference with the absorption of thyroid hormone.
She hasn't, I don't think she started it. I think this was last week she asked about it. I think she wanted to start taking something to relieve, anxiety or something. So I was just, I don't know if I asked my question clearly, if she hasn't started any of the adaptogenic stuff yet, is when you had mentioned the TSH being really low and suppressed and having a heart rate, abnormal heart rate or anxiety, would that be a possible connection?
Yeah,
If, okay.
I would say
Okay.
so because I'm on thyroid medicine.
Yeah.
I have been for some time, and I've been prescribed several dosings, and I know when I'm overdosed on thyroid medicine, anxiety, heart palpitations, insomnia, especially if someone was sleeping good previously and then they're starting to experience that, they could be um, over medicated on thyroid medicine.
Okay.
I like gentle adaptogens. L-theanine is probably one I really like. Um, GABA seems to be helpful for some individuals. I like ashwagandha. I like holy basil. I just think that it just depends on the person. I've also seen people take ashwagandha and not feel good and be overstimulated. So I think where your nervous system is to start has a lot to play with that.
If it interrupts absorption of thyroid medication or has the propensity to do it, is there any time to take it, or is
No
it just in
way.
general?
Yeah, I would
Huh?
take it furthest away. So
Oh.
anybody who's prescribed thyroid meds, they say to take it first thing in the morning on an empty stomach and wait about 30 minutes to help with absorption. So in theory, you'd probably take your ashwagandha at the opposite end of the day if people are trying to relax. That would be my recommendation. You're really not supposed to take any supplements with thyroid medicine. Uh, I don't know if that's an adherence thing or if there's actually like much data supporting that, but I've always done it that way.
Okay.
But yeah, I would say if they are reducing her thyroid, and I know she's tired of getting poked with a needle, but probably looking at it again in 8 weeks, because at one point she was severely underdosed and was having a lot of symptoms. So I think there's a lot of swing in the pendulum here. So I would keep an eye on that. I do have something in the chat box. Tulsi. Yeah, thank you, Ashley. I couldn't think of that. Tulsi tea, very common. Um, all right. And then we have another set here. And this is for a client who's been here for about a year, I believe. And some of the things that I notice here, and let me pull up her initial set. Um, Some of the things I see on this follow-up set is the A1C being around 5.7. I guess questions I would have for you, Charlotte, in regards to um, body composition, calories. Are you currently in working through like a deficit with her? Is she in a more of a maintenance or surplus phase? And is there any symptoms as or feedback from a client coach perspective that would tell you that she's having some issues regulating her glucose?
I would say in general, the logging has been inconsistent and there could be a propensity for higher carb intake in general and lower protein.
Yeah. Yeah, some of the things, because not even talking medications or peptides. Everybody always wants to, that's their first lever. I think that you won't really be able to achieve much if you're not looking at that lifestyle component. So, walking, balancing your meals. So, fats, fiber, protein, and each of your sittings, not grazing. I think those are some things that could help with the A1C. There's a lot of other interplay that can cause glucose to average to elevate. Um, for those who don't know what the A1C is, it's an estimation of your blood sugar over 90 days. So I like to look at that in conjunction with fasting glucose and fasting insulin. These labs were done through her one of her doctors. This is not something that we do internally. So we don't have the insulin, but we do have the glucose. So if these were fasted, it is a 96, and then her A1C being a 5.7. What do I think about A1C as a whole? I think it's a pretty good like inflammatory marker to look at. If you have issues regulating your blood sugar and it stays elevated, it is a pro-inflammatory state for your body. And kind of figuring out that root cause. If we're looking at minimal diagnostics, I would start with balancing your meals, not grazing, walking, resistance training. Those are going to be some of the things that help. Sleep plays a role in that, adrenals, GI. There's a lot of other interplay there, but if we're just talking about some of the basic things that we can look at on this test, I would say those would be areas I would focus on. A1C and high blood sugar also is going to make it really hard to lose weight. So if you have high glucose, your body's in a pro-storage mode. So food you eat is more likely to be held onto, and fat tissue, blood sugar stays elevated. You have a hard time oxidating fat. So you want to think about when you're walking or lifting weights, doing yoga, eating in a calorie deficit. Your body's able to oxidize and burn free fatty acids. When you are in a elevated glucose and potentially insulin, your body's going to be more likely to storage those things and less likely to be able to burn body fat efficiently. So I think that multifactorial with the A1C, kind of looking through the CMP, because there are good nuggets in here. I know everybody gets a CMP done. Things that I look at, creatinine, GFR. So kidney function, it'll give you an idea. Less than 60 is in uh, uh, potentially issues with renal insufficiency or kidney damage. So based off of the estimation off the bun and the creatinine, the EGFR is somewhat normal. Electrolytes, potassium, sodium, chloride look good. Carbon dioxide. I also like to look at the bilirubin and the ALT and AST just to get an idea on liver function. I don't think that they're the best indicators, but you can definitely gather some information on that. Nothing's abnormal, but it doesn't mean there's not issues occurring at the liver. Just maybe not something at this point in time or severe. Uh, I am also curious because they tested a couple other things here. Her RDW is low. And then they were pulling things like her folate. So her folic acid is low. And they were checking her B vitamin. So I don't know if that's an energy thing or an anemia thing, Charlotte. Do you have any insight on that?
Definitely her energy levels are not optimal by any means. There's definitely more lethargy and brain fog and uh, overall malaise, I would say.
Yeah, I would think that and bees, I think bees are helpful. There's a lot of bees, so I don't know, everybody just looks at B12. Um, I think that looking at the B12 and the folic acid, they should probably do a homocysteine to see if there's any other issues with other B vitamins, riboflavin, B6. Those things stick out to me. I would say that I would recommend increasing folic acid through diet. Leafy greens, fresh leafy greens are a good way to do that. You could take a methylfolate supplement. I take methylfolate. I think it's pretty helpful. Not everybody's deficient in it, so looking at the folic acid is helpful. And then her B's are okay. It's a 601. The thing is with B vitamins, they're water soluble, so they can wax and wane quite a bit. I'll look at more sophisticated testings of B's if I think someone's deficient in them. Methylmalonic acid is more tissue specific. But I would say looking at this, she doesn't look like she's deficient in B's. I know her vitamin D doesn't flag low, but I think it's abnormal. So if you look at like adult ranges, and it starts at a 20 nanograms per milliliter, and then suboptimal is 29 or 20 to 29, and then optimal is 30 to 100. I really like D's around 60 to 80. So I would be getting some more D's in. And if she is getting a D and she's not absorbing it, K2, take it with food. Those are, I think D is one of those vitamins that helps with inflammation, immunity, cognition. There's a lot of benefits to it. So those would be some of my recommendations there. I know you said she is on a thyroid medication. The only issue with a lot of primary care offices, all they checked is with her TSH. So we just looked at a set of labs where TSH was really low and the free forms of thyroid were not really high. So just looking at a TSH, I mean, it looks normal, but again, it's just a stimulating hormone. So we don't really know what's going on. Um, I don't know if she does any labs to our program, but looking at that full set probably would be helpful, specifically with thyroid. And then if she's on bioidentical hormones, you definitely want to check those pieces as well. I think those were all the specific things. Does anybody have any specific questions about these? I also just wanted to open it up to a Q&A as well. Maybe we spark some interest or somebody has some similar labs. We'd be happy to talk through that as a collective. I have Charlotte, Ashley, Sophie here. So definitely utilize us.
I I think I've asked this question in the past, but being fairly new, do you guys ever have any clients, customers, patients get Freud, get off levothyroxine, get off the thyroid meds, any version of any kind? Just curious.
Yeah, I would let some of the coaches kind of talk through that. I do a lot of the diagnostics. I would say they're probably going to be the ones working through the lifestyle, the nutritional pieces, and if they have any existing or former clients who've come off of thyroid medication. So, do any of you have insight on that or have done that previously with the client?
I have not personally had anyone come off it so much as lowering the dose in general.
Hmm.
That's been the biggest thing I've seen.
Okay. Well, maybe I'll be the first, right?
It's always possible.
That goal, because my goal is to get off a couple meds, and I will share. I don't even know if you know, I got off a lisinopril last week for the cardiologist. So I was like, yes, one down, two to go when it comes to meds. And I just wonder, because I have so many friends, we're all on Synthroid. We're either all on Synthroid or lisinopril for blood pressure. But I know if I can help to figure it out or help, others in any way or get off of it, that would be, you'd have a lot of clients flooding you guys. So
Um, how
cool.
long were you on the lisinopril?
So I had, it would be 1989, because that's when I had low blood pressure my whole life. I had it history, married an idiot, and my blood pressure shot up the year later. So I'm not quite sure if it's because of who I married or the stress or whatever. So I would just say 1990, 91. We figured out the dosage and it ended up being lisinopril. So what is that? 26
36.
years. Yeah, and it just the dosage adjusted a little bit. But unfortunately or fortunately, I actually had to have I have a cardiologist because I had open heart surgery in July of 21. And that was from an aneurysm and not heart attack, arteries, none of that. But still the same. And I told him my goal is to get off lisinopril. He goes, well, let's wait, do this, like let's work on some things. And last Wednesday, my blood pressure has been down for a solid year. And he's like, all right, time to come off. You can just quit. I was like, seriously? So that was Tuesday or Wednesday was my last lisinopril. Very small dosage though. I was at a very low. I kept coming down, but the goal was to get off. So yeah, long time.
That's great. Yeah,
Yeah.
I would say I would be curious, and I'm sure people are curious from a lifestyle perspective, what are things and you and your coach are doing to help regulate your blood sugar or your blood pressure?
I think a part of it is Ashley's gotten me to eat
Yeah.
calories, good calories, because I really haven't changed a lot of the food, but I did do the non-dairy, and it's only been what, not even 2 weeks. So non-dairy, and I was already doing gluten-free. I don't drink alcohol for the last few years because I swear menopause screwed that up. But I enjoy not drinking because I don't get the headaches and stuff. So probably the eating for me is very different. That's a lot of calories, but we're there or getting there. But now it's like, okay, I watch the sodium go up. So I'm like, oh no, that's got to come down. So it's just learning what to do, what kinds of foods, but things that I like, to eat. Like I loved Chobani yogurt, but it's dairy. So now you got to go look at coconut milk or almond milk or cashew and find, versions of something that you like. Now, I have probably had less yogurt in the last 2 weeks I've ever had in my whole life, which is fine. There's lower grams of protein in them, which is fine. So you just find it in other ways. So I can tell you edamame, roasted edamames have found those in the last couple of weeks. But it is the food, the schedule, the timing, and I'm preparing for a big business trip next week. So taking stuff with me and figuring out, calling the hotel, you know what I mean? Like just figuring things out, not just packing and going. That was normal for me because I've been traveling on the road for 30 years. So yeah, I would say it's the food's the biggest thing for me. And doing the exercises that I like to do. I don't want to go run a marathon
Me either.
more. I just want to walk, swim, yoga, and my girlfriends that are going on the business trip. There's a bunch of us going. We're going to walk the 6 floors of the hotel. We decided to do as a team. So I got my support team going for the business trip. Let's do it. 6 o'clock, guys. We're going to be walking all the floors up and down. And so yeah, we'll see see if we can do it 2 times. That'll be the goal by the end of the week. But yeah, I think that and like triggering the sodium triggered something for me. Like, whoa, wait a second, that's too much for me and my goals. So I'm working on that the last week, and I think picking up meditation again, because I know it works and it's great. And right now it's only 5 minutes a day, but it's my 5 minutes and nobody else's. So I like that. But yeah, it was exciting though, getting off lisinopril last week.
Yeah, that's
That was,
awesome.
yeah, it was cool. Very cool.
I
The
think
cardiologist is all into this, whatever he said you're doing. Just, give it all that you have. And he's so cool. And he always says, let me know what I can do for you. I said, okay. So, yeah.
that's great. Yeah, I think the food is a big piece. I don't know if there's more diversity in fruits and vegetables, but a lot of electrolytes like potassium, sodium. I think for a lot of people, especially if somebody is Um, Eating out or eating prepared food, there's always a lot of extra sodium in that. I see people could be low in other minerals, magnesium as well, and that can create an imbalance of electrolytes, which can raise blood pressure. So eating the right foods is definitely a piece. Meditation is a cheat code for managing blood pressure. I'm not as good at it, but I attempt. Let's say exercise is also, all of those things are great. And when you kind of combine them, is best case scenario. Yeah, I think a lot of people get put on medicine and don't really challenge or want to come off of it. So, doing the right things from a lifestyle perspective is awesome to see you come off of that after so many years.
Especially when it, 8 years ago when you weren't overweight and you're still on blood pressure meds, you're going, okay, what is it? So then you go to the therapist and they're like, well, you're stressed out. Oh, okay. How do I take care of that? So yeah, working on the any kind of stress. I believe stress causes inflammation and that's just not good. So we have
Yeah,
to take so yeah. So got rid of previous ex-husband and moved and built a house. So we're good.
sounds like you're leveling up. It sounds very good. I'm happy for you.
Getting into the golden years. So
Well, thank you for sharing.
Hey, this is Carol.
hi,
I'm
Carol.
very new. I just had my onboarding call with Sophie this morning, but we were talking about because I've been on a GLP-1 for 7 years, from the beginning, sort of, kind of, before people even knew what the heck it was. I went from Ozempic to Wegovy to Manjaro. I'm on Manjaro 15 right now.
Okay.
I just, there was never any plan. Like, how the heck do I get off of this? I
Yeah.
heard you talk about that you go on it sometime and go off it, and I mean you use it as a different kind of tool. I mean it did get me to the point where I'm under 200. I've adopted a lot of lifestyle changes. um I'm here for the comprehensive program, but is there going to be a possibility for me to
I would
get
say absolutely. Thing is, with the GLP-1s, you have been suppressing certain hunger hormones for a long period of time. So, the big things you want to think about is slowly reducing dosing. I would work alongside your provider, get their insights on that. But if you're pretty much max. If you're at a 15, I think the max dose is like 16.5 or maybe 16 flat. Um, One that gets it can get expensive, especially if insurance doesn't cover it, and it leaves patients kind of searching for next options. I don't think there's enough education around nutrition with the GLP-1. So, yeah, I would say talking with your provider and figuring out a reversal process. So if you're at 15, and this is all hypothetical, it may be eight, and then it may be four, and then it's two. And then while you're doing that, you're working on fixing a lot of hunger hormones. So you're suppressing ghrelin for a long period of time, your hunger hormone. Leptin, your satiation hormone, will also suppress there. So you working with your coach to slowly increase calories is probably going to be helpful. Other things that I would think about there is getting an understanding of where your calories are now. And I'm sure Sophie's working on that with you. Your first week is, what does my normal food look like? How much of that am I consuming every day? Um, those are things that I think about. So say you're at 1,000 calories, and this is all hypothetical, working your way up to 1,200 over time, and then so you're around 14 right now, getting up to 16 and then 18. And if you're doing that very gradually and exercising, you most likely won't gain very much weight. And I'm a big proponent of strategic eating and slowly adding calories back in. Because if you're eating just in theory 1,800 calories, you probably don't need a GLP-1. Or if you're eating 2,200 calories, you're going to be pretty full, especially if that food's coming from unprocessed whole sources. That's a lot of food. I think the average American, we are eating such a calorically dense diet. When you tell somebody, oh, you only eat 17 or 1,800 calories, for some people, that may be two fast food trips. But for somebody who's cooking food at home, I mean, that's a lot of fruits and vegetables and lean meat. And you could be really satiated off of that. So, to answer your question, staggered dosing down. I wouldn't cold turkey it. And then working up your food over time. Resistance training is going to be helpful. I also think looking at all your other hormones, making sure your thyroid's okay. Um, the GLP-1s do a wonderful job of regulating blood sugar, but it is a medication doing that. So we
Yeah.
may need to figure out ways to support your body's ability to regulate blood sugar and insulin naturally. And there's herbs and other things that we can do to help with that.
Yeah, I'm really interested in that because I just can't just keep doing it.
Yeah. The crazy thing is, because I know a lot of people who use those, is eventually they just quit working. So if you're at a
Of
15,
course, yeah, I've seen that. Yeah, for
your,
sure.
your
You lose
hunger,
the initial, like when you're eating, you lose that say feeling of fullness fairly quickly, even as you because your body gets used to it, right? But overall, I'm not hungry. Like I don't even think about it during the day. Um, and yeah, it's been, and I'm looking at, even just tracking this last week about what I'm eating. I'm used to eating not a lot. Where the calories are coming from, it's like alcohol on the weekends. It's like when the calories are up. But during the week, yeah, I'm down, 11, 1,200, not even sometimes. Um, I know. And she said 120 grams of protein every day. I was like, what?
protein is definitely your friend. Figuring out ways you like to eat it and how to maximize the times you're most hungry to get enough food in. But it's a process for sure, and your digestive tract has to relearn how to digest, so much protein over time, and that's the beauty of everything that we do. We integrate a lot of GI stuff with hormones. We're able to look at it from multiple lenses and support clients through that process.
And I do, there's certain things I don't want to eat anymore because of that GLP-1, how it affected my digestion. If you eat certain thing, too much of certain things, and maybe too many, like I noticed like fat or like pork is not my favorite meat anymore because I look at it and I go, I feel so good after last time I ate that. So even
Yeah.
though I may not be having that problem now, it's like I remember what happened to me in the beginning and I'm like, I don't want to eat that.
Yeah, totally with the slow digestion, large fatty meals can be very hard to digest. You'll see, maybe some issues with bile at the gallbladder releasing, and you could have some changes in bowel movements with the GLP-1. So I think coming off of that and kind of feeding your body the right foods, it helps with everything: hair, skin, nails, sleep, stress management, the whole nine.
Don't boil.
So I think working with your coach and coming up with all the things that you enjoy eating, and then working through that process, it definitely takes some time.
Yeah, no, I know it took a while to get up there. So I know. I remember one of my doctors, well, I got a new one now. So the old one was an endocrinologist, and she was like, yeah, the more you go up, that's more times you gotta come down to get off of it.
Yeah, absolutely.
And I'm like, and this guy thought the solution was to go up because I was gaining weight. I didn't do anything. I went from 10 to 12 and a half to 15, and recently I've gained what, like 6 pounds. So, yeah. It's not
Looking,
the big bullet people think it is. Those commercials really piss me off.
there are a lot of the commercials, absolutely.
I'm like, people, you don't understand. It's not. I said, it doesn't work unless you work.
Yeah, yeah, and I don't I never really demonize anything. I think that they can be helpful tools, but it's just in the right scenario, and patient education, client education, like understanding food. Those are big things that I focus on with people.
Yeah. I don't think a lot of people get that.
Well, we're
So,
glad you're here. Thank you for
thank
sharing with us. I have another question here. So, Andrea, I finally got a 9 a.m. serum cortisol and a plasma osmolality test and IGF-1 test, amongst many other blood tests to assess my pituitary gland. In a month, an endocrinologist will have a look at them. Yeah, I think that the serum cortisol testing will probably shed some light. And um, looking at the IGF-1, that's interesting. Was that a request from you, Andrew, or was that something they wanted to do? And I'm just curious on that process. And I can kind of talk about how I think about
Yeah,
IGF-1.
yeah, they wanted the endocrinologist, my GP referred me because my cortisol is quite low and my prolactin is quite high and thyroid is quite low and they did this HCTH stimulation test
Mhm.
last year, so they know the adrenal gland is okay. So with those three tests, amongst other blood tests, but these three should specifically assess the pituitary gland, like the anterior and posterior, and just to see whether it might be hypo, hypo,
Hypothalamic.
hypopituitarism. Yeah, that's kind of what they want to check.
I'd be interested to see if they test your growth hormone with your IGF-1. IGF-1 is a byproduct of growth hormone. You release IGF-1 from the liver. The reason they'll look at growth hormone in conjunction with cortisol is um, my assumption if they're checking the IGF-1 to see if you have an excess production of growth hormone and then potentially having spillover from IGF-1 because IGF-1 metabolites are not inactive, but they're just a secondary process, and a lot of it
Okay.
is made from the liver. So yeah, I'd be interested to see what that looks
No,
like.
I don't think they haven't planned that. I got a form with things, I have it here, with things they want me to get tested. And I mean, the LHFSH, obviously, all the thyroid things, bone profile, lipid glucose, all that. And they're not checking on the cortisol. They're not going to check for any like renin or aldosterone or DHEAS or any of that or growth hormones.
Yeah, the aldosterone and renin, more renin and angio renin. Those are going to be released from the kidneys. A lot of times it has to do with blood pressure. I think there could be some changes with cortisol to that, but I think it may make sense why they're not testing that. I would
Yeah,
say I specialize more in like hormones. When we start getting into kidneys and some of those things, I know a little bit, but I'm not going to pretend I know a ton of that.
yeah, yeah.
I would say I
No,
would.
I just wanted to tell you that I'm finally getting the chance to check out what's wrong after we knew all year that there was problem with the hormones.
Yeah, I think the issue is a lot of times with the cortisol, it's not enough to you know, be a physical harm to you, but it can really impact quality of life if it's
Yeah,
chronically low. So they deem you healthy enough that your adrenals will make enough to keep you going and keep your heart pumping, but
yeah,
may not be enough to make you feel okay.
yeah, exactly. That's kind of, I had to almost force my GP to make that referral.
Well,
So yeah,
it's good to advocate for yourself and just
yeah,
learning more about all this stuff is giving you more information to understand what's going on instead of just
exactly.
walking through the motions.
Yeah, exactly. And yeah, I just wanted to say it's my last week. I've done a 12 months now, and I've really profited a lot from it. I've lost a lot of weight. I've learned how to eat. My gut is much better. Most of my bloods are better. Um, through hormone happy now hours, I've learned so many things. Um, from Ashley, of course, as well. So, and any of the team, really thank you for everything, um, for your work and helping me to get better.
Thank you so much. Yeah, it was a pleasure working with you. I'm glad we were able to resolve some things, and I would definitely keep going. I think you have a lot of great foundational pieces to work off of.
Yeah, I actually made measured my metabolic age again. I started at 59 in 2003. Beginning of this year was around 48 and now 38. So I'm getting metabolically very young.
That is amazing.
Uh,
Yeah,
so
I'm
yeah.
I'm happy and to kind of see the progress of um, overly fatigued and tired and not understanding as much to learning a lot more about your body and what you can do and to improve symptoms and labs. And yeah, I think that's
Mm,
amazing. So I appreciate you sharing
yeah.
that with all of us.
Thank you very much.
Do we have anybody else? We have a couple minutes left. I wanted to stop and see if we can answer any more questions. Krista, here we go. Can you talk about inositol and berberine? They are comparable in your opinion. Do different, in your opinion, do different things, looking at them for lowering A1C without prescription. Yeah, I would say what I've seen work probably best is a berberine. In my opinion, just like through years of clients using it. Some clients have digestive issues with berberine. Dihydroberberine could be another option, or inositol could be. I think either of them work fine. I would say I would try berberine. It is less expensive than dihydroberberine. Quick ways to check if your blood sugar is improving is a glucometer is really inexpensive. You could buy one at Walmart. Prick your finger in the morning, check it, see what your fasting glucose is. Do that once a week for a month while using berberine. See if you're getting lower fasting readings. If not, you could think about switching to one of the others. I think dosing matters as well. Berberine can be given 500, 1,000, 1,500 milligrams. Again, GI stress can be present, so you could do a dihydroberberine. They're usually a lower milligram, but apparently the absorption rate is better with that, anywhere from like 150 to 400 milligrams. Um, I think I don't want to say that I've used an acetol a ton, but I have recommended it for some people. I just have more data on berberine. I see that being more efficient. I don't know if coaches would agree with me on that, but I tend to see that working better. Liquid over pills. So I like liposomal deliveries. I think those work fine. Basically, you can get a liquid liposomal berberine. It's basically like an extra fat layer over that berberine to help with absorption in the GI tract. Um, I think the big thing is, does berberine irritate your stomach, and do you need to use something else that doesn't irritate it? It could be heartburn for some people. It could be loose stool for some people. I know Ashley uses it a lot in her GI protocol, so it does have some like antimicrobial properties. So I also think maybe it could influence what's already present in the gut. Yeah, I would say I would play around with them all. Maybe start with the berberine and see how you respond, and if you have some negatives, change to one of the others.
I appreciate that, Justin. I've taken berberine before in a pill form. It didn't have any effect for me. The A1C still stayed at 5.57. I've been talking with Charlotte on all that, trying to look at a natural way to go about doing this instead of like metformin or any of those type of things first. I was told by a nurse practitioner to try liquid berberine and do it right prior to eating a meal. Would you agree?
Yeah, I'd say around mealtime. If you forget, I wouldn't just forego it. I'd take it afterwards. Uh,
Yeah.
I would say like around the time you eat it, it can definitely help. Um, there is like one study where they compare berberine to metformin. And it does show some comparable results. I think it really just depends on, again, I would work on the dosing. So I don't know if you were doing a capsule, if it was 500, or if you were doing it multiple times a day. But if you have a higher likelihood of having elevations in blood sugar, you probably need multi doses throughout the day.
Okay, I appreciate it. Thank
Yeah,
you.
absolutely. I'd say that, and then the working on the food component, movements. I know that we were talking about your unique scenario and coming off of working crazy hours and doing very stressful things. That's going to impact your A1C too, to a degree. I think stress and cortisol. So as you kind of come in and wind down and settle into what you're doing here at the coaching program, you probably will see some improvements in that from several different factors.
All right. I look forward to that. Thank you.
Absolutely. Thank you.
Justin, I have one quick question about the second lab that you read. There was one more reading for the testosterone, it was 103. She was wondering if that was considered high or in range for testosterone.
So it is clinically high, but I think it depends on the context there. Is she having more symptoms? So if hair loss is present, that could be a contributing factor. Um, I think that if she has acne, if she is having any issues with oily skin, overly aggressive, things of where testosterone could be high, it just depends on the lady. And I wish I could say like, oh, it's a within this range, but I've seen people who like their testosterone at like 50, and I see some ladies who like it like at 125. So I think there's a lot of like genetic difference there from person to person. Someone's prone to hair loss, prone to acne, has maybe excess androgens in general, they could have more of a negative response.
Perfect. I'll keep that in mind for her.
All right, everybody. Well, thank you all for joining. It was great talking with you all, and we will be back in 2 weeks. Hope everybody has a great rest of their day.
Okay.
Take care.